I'd like to introduce our last speaker for the day, Milan Scheidegger. He holds an MD degree and completed his PhD in functional and molecular neuroimaging at the Institute for Biomedical Engineering in Zurich. He's a resident physician at the Department of Psychiatry, Psychotherapy, and Psychosomatics in Zurich, and he's currently researching the neurobiology and pharmacology of altered states of consciousness. He is a member of the Swiss Society for Psycholytic Therapy and investigates the potential of psychedelics such as ketamine, psilocybin, ayahuasca, and DMT to facilitate therapeutic transportation. Please welcome him. Thank you.
Yeah, it's my great pleasure to present recent findings from quite an extraordinary study that we did in Zurich about psilocybin, the potential to facilitate mindfulness-related capabilities in a meditation retreat setting. This study was directed by Professor Franz Vollenweider at the Hefter Research Center in collaboration with Zen teacher Vanya Palmers. The slides. The psychospiritual use of psychoactive plants is widespread among many shamanic cultures of the world and is currently being rediscovered by science and medicine. Indeed, several studies show that under supportive conditions, psychedelics can induce personally meaningful and profound transformational experiences. From a phenomenological perspective, these drug-induced states share a striking resemblance to mystical experiences reached in very deep meditation. In these states, the usual ego boundaries are dissolved to a degree where the subject of the experience feels universally connected with all existence. Such experiences can be deeply transformative, and mindfulness-based disciplines might serve as a valuable framework to potentiate beneficial outcomes. An important historical reference to the empirical investigation of drug-induced mysticism is the so-called Good Friday experiment. In this study, 20 students of theology received either 30 milligrams of psilocybin or 200 milligrams of nicotinic acid in a double-blind randomized design in a church service in the Marsh Chapel of the University of Boston. Psychometric assessments revealed that psilocybin subjects experienced significantly stronger mystical experiences than controls. They ranked among the most significant experiences of their lives, even in the long-term follow-up. A high degree of persisting positive changes were reported by the experimental group compared to the control group. If drug-induced mystical experiences are so deeply transformative, what are their core phenomenological features? According to Walter Stace, these include a feeling of unity, transcendence of time and space, a deeply felt positive mood, a feeling of sacredness and awe, objectivity and ultimate reality, because the critical distance between the subject and object of experience is dissolved. So no critical distance can be taken. And paradoxicality and ineffability. It has been observed that the most favorable outcomes in treating anxiety, depression, as well as addiction are associated with subjects undergoing such a powerful mystical type experience. However, further research is needed to clarify how these drug-induced experiences mediate the beneficial outcomes of psychedelic therapy. In our study, we developed these ideas further and reissued kind of a Buddhist version of the Good Friday experiment in a meditation center located in an aesthetically pleasing setting in the Swiss mountains. We invited experienced Zen and Vipassana meditators for a 5-day silent retreat, including a double-blind placebo-controlled intervention with psilocybin. Participants practiced under the guidance from Zen teacher Vanya Palmers and under supervision from a team of psychologists and physicians from the Hefter Research Center, Zurich. The structured meditative discipline, known in the tradition of Zen Buddhism as a sesshin, consisted of a daily 15-hour program, including typical elements of mindfulness-based practice like sitting meditation, zazen, walking meditation, kinhin, mindful physical work, samu, interleaved with breaks for rest and meals. The participants were instructed to observe silence. The retreat consisted of 3 phases: 3 days of preparatory meditation, then pharmacological intervention at day 4, followed by a day of meditative integration. All 5 days followed basically the same schedule, and at the day of pharmacological intervention, some additional short periods of relaxation were allowed in between, but as you can see from the movie, our participants handled the experience pretty well and followed the meditative discipline even under the effects of psilocybin. This is a short trailer from a documentary about the study, and it's going to be released by filmmaker Milos Savic. Milos Savic is currently looking for financial, also production team member support to push this exciting project forward. So in case you're interested in getting involved, please get in touch with Milos. After the initial screening, 36 healthy and experienced Zen or Vipassana meditators with an average of 5,600 hours of meditation experience and little or no experience with psychedelics were included in the study. Psilocybin and placebo were administered in a double-blind, placebo-controlled between subjects design. On the day before and after the retreat, functional MRI scans were collected to perform additional brain connectivity analysis, and 4 months after the retreats, changes in psychological well-being, behaviors and attitudes were assessed by the participants, but also by closely related family members and friends to include also a third-person perspective. Just briefly, a summary of the behavioral results before we move on to the neuroimaging results. So as expected, psilocybin induced profound altered states of consciousness, particularly for the dimension of positively felt ego dissolution and visionary restructuralization. Despite the comparatively high dose of psilocybin, almost no anxiety was observed in this setting, so we think a mindfulness-based setting might be very valuable to reduce the distressing aspects of the experience. The psilocybin group scored comparably higher on the phenomenological features of deep meditative states as measured by the mystical experience scale, and the single psilocybin-induced experience was valued same as the whole lifetime mystical experience, and notably the placebo group scored both lower on acute mysticism during the retreat, which was quite obvious here. As expected, also the self-reported meditation death increased, especially at the day 4 of drug administration in the psilocybin group, but also there was a general trend for increased meditation depth in the placebo group over the retreat. If we compare pre- and post-retreat levels of mindfulness, we found a significant increase in the psilocybin group, supporting our hypothesis that psilocybin has the potential to increase mindfulness-related capabilities. And interestingly, the higher meditative mindfulness scores were correlated negatively with distressing aspects of the psilocybin experience, such as anxiety, anxious ego dissolution, or fear of loss of control. So this shows that a highly mindful mindset with a non-judgmental, non-reactive, accepting stance towards the content of experience might be suitable to better navigate through the psychedelic experience. Our findings from the 4-month follow-up indicate that the psilocybin group has positive lasting changes, including appreciation for life, self-acceptance, and sense of purpose. The positive life changes were associated with the overall intensity of the psilocybin experience and also with the spiritual nature of the experience. Notably, the positive changes were also corroborated by close relatives or friends, so the findings are less biased to subjective expectancy. So in conclusion, psilocybin, when administered to experienced meditators in a double-blind, placebo-controlled setting, may facilitate profound, meaningful experiences. Mindfulness-related capabilities were significantly increased in the psilocybin group and were associated with less distressing aspects of the psychedelic experience. And we successfully tested the safety and tolerability of psychedelic experiences in a ritual group setting that allowed for proper preparation and integration within mindfulness-based framework. And finally, by increasing psychospiritual development and well-being in the long-term follow-up, psilocybin, but also other psychedelics might possibly become therapeutically valuable tools for integrative, transformative healthcare. Next, I move on to our neuroimaging findings. We were interested in the psychological and neural sub-process that observe the process of meditation in this particular setting. From a psychological perspective, mindfulness is typically described as a non-judgmental attention to experiences in the present moment and describes practices that require both the regulation of attention, emotion, and self-awareness. In the early stage, meditation resembles a state of effortful doing, while with increased levels of expertise, mindfulness is experienced as a state of effortless being. Most of the day we engage in mind wandering, or what Buddhists call the monkey mind. Our stream of consciousness is crowded with cognitive and emotional evaluations of past, present, and future sensory or autobiographical events. In contrast, mindfulness meditation can be subdivided in methods like focused attention, concentrative practice, or open monitoring practice, where the attention is more directed to the whole of sensory experience. During focused attention, the aperture of consciousness is typically narrowed to the physical sensation of the breath. And whenever the mind wanders off, the meditator brings the attention back to the breath again. So this practice is aimed at reducing emotional reactivity and mind wandering, while open monitoring meditation is actually a more receptive state of consciousness, like all sensory modalities that come into awareness are represented in consciousness, are not judged, not changed in any way. So psychedelic states resemble more kind of this open awareness state, sometimes even called a mystical state or a non-dual state of mind. Therefore, we hypothesize that psilocybin will have more impact on open awareness practice compared to focused attention. So there are several brain areas that are involved in the process of meditation. Brain regions involved in attentional control include the anterior cingulate cortex. Brain regions involved in motion regulation involve more prefrontal and limbic areas, while self-awareness is linked to the activity of the insula as well as cortical midline regions such as the anterior and the posterior cingulate cortex. In order to understand how the brain works, we have to look at the component of brain activity that consumes the most of brain energy, which is the random episodic silent thought or resting state activity. And this can be analyzed by extracting the large amplitude, low frequency fluctuations in the fMRI signal. And we see that certain functionally related areas are tightly coupled over time. So we see patterns of correlation and anti-correlation. For example, here in orange, the task negative network is showed, which is active usually when we do nothing or engage in mind wandering, while the task positive network here in blue is anti-correlated and usually engaged in different tasks. So the default mode network, which is active during mind wandering, is also considered the neurological basis for the sense of self. And altered default mode network function is thought to underlie maladaptive self-referential processing that is also commonly found in psychiatric disorders like depression. So to modulate this default mode network function was proposed a potential biomarker for effective treatment. In previous studies, we found, for example, that ketamine, as a rapid-acting antidepressant, reduces default mode network connectivity within 24 hours of administration, but also other psychedelics such as ayahuasca or psilocybin have been found to reduce the activity in the default mode network. But not only pharmacological interventions are suitable to reduce biases in self-referential processing, also meditation has been found to affect default mode network function with a similar pattern of reductions. So all these interventions share kind of a common biosignature with impact on self-referential processing. So we were specifically interested in how the psilocybin-enhanced meditation retreat would affect the functional connectivities in specific areas of the brain. And this is actually a cycle of meditation showing the different networks that are involved in a usual focus practice on the breath. And we explored these networks systematically during a resting state scan before and after the retreat, a focused attention meditation that was followed by an open awareness monitoring meditation. We used both C2 voxel and independent component analysis. And here I will show you or guide you through the results. So meditation alone, without the effects of psilocybin, increased within network connectivity here in the posterior cingulate cortex if you compare pre to post retreat fMRI readouts. And it was very interesting to see that also here, if you look at the power spectra, there is an increase in low frequency fluctuation and a huge decrease in the power of higher frequencies. So meditation seems kind of calming the mind or also the brain function, making brain function more homogeneous. If we look at the seed voxel analysis, we find that seed regions like the posterior cingulate, which is the major hub of default mode network processing, is more connected to visual and occipital areas involved in visual imagery and less connected to areas involved in executive control. So the whole brain switches kind of from a more doing-oriented to a more being-oriented mode of information processing. During focused attention, we found a similar pattern, like a stronger within-network connectivity in the default mode network. So the brain actually during meditation becomes more rest-like. So the activity resembles more the resting state. Even the lower frequency signal amplitudes were increased even stronger compared to the resting state, predominantly in default mode and effective regions. Here we see the seed region analysis, again the pattern of reduced default mode network connectivity with focused attention and increased connectivity to executive control areas. During open monitoring in the insula, we found a spot of increased within network connectivity representing like a heightened state of awareness. And the pattern here looks completely different. We find increases in thalamic frequencies, which is particularly interesting given the role of the thalamus in filtering information into consciousness. So if the aperture of consciousness kind of opens towards all sensory modalities of experience, this seems to be also reflected in altered thalamocortical circuitry function. If we look at the seed correlation analysis, we find again stronger involvement of executive control networks representing this executive control state, and less involvement of default mode network and effective regions during open awareness. With psilocybin, we found specifically increased homogeneity or within network connectivity in the anterior cingulate cortex, which is particularly relevant to emotion cognition interaction. The anterior cingulate cortex plays an important role to mediate between more cognitive and more emotional relevant areas, which might have clinical importance as well. So default mode network function is affected in open awareness and psilocybin in the way that anterior nodes of the default mode network are less connected to posterior parietal areas, but the posterior parietal hubs of the default mode network are stronger connected to parietal areas, which is intriguing since in meditation, deep meditative states, it was found that this area in the posterior parietal lobe is specifically altered in terms of brain perfusion with a pattern of hyperfrontality in anterior brain networks. Here, another summary of findings from ketamine and psilocybin-induced states of oceanic boundlessness, which involved also kind of this angular gyrus and parietal cortical areas and frontal areas, and other evidence from lesion studies which show that patients with lesions in this area score higher on self-transcendence and spirituality. So this is particularly interesting. And the last finding I'm going to show is that we find a specific reduction in anterior deformal network connectivity that was related to oceanic boundlessness during the psilocybin experience, which shows that even 48 hours after the psilocybin meditation, the connectivity in these self-referential systems was lowered during open awareness monitoring, which is also reflected by these studies with psilocybin, ayahuasca, and meditation. So we have kind of a common pattern. In the interest of time, I will skip the summary and come directly to the conclusion. So we see that mindfulness and psilocybin have both promising impact on transformational healthcare by their similar mechanisms, which is dissolving kind of ego boundaries and attenuating self-referential processing, and symptoms are thought to arise actually at the boundary between self and world. But if the boundaries between self and world dissolve, there is no longer anybody to have fear or to have depression. So this liberating process, which is aimed at through mindfulness and through psychedelics, might be particularly relevant for transformative healthcare and for treating conditions where a very narrow-minded focus or pathologies, maladaptive forms of self-referential processes are prevalent. So I want to close my talk with a quote by Albert Hofmann about LSD, but I believe that it is also true for other psychedelics, not just LSD. I believe that if people would learn to use LSD's vision-inducing capability more wisely under suitable conditions in medical practice and in conjunction with meditation, then in the future this problem child would become a wonder child. I see the true importance of LSD in the possibility of providing material aid to meditation aimed at the mystical experience of a deeper comprehensive reality. Such a use accords entirely with the essence and working character of LSD as a sacred drug. So I want to thank all my collaborators, especially also Vanya Palmers and Lukas Smigielski, who managed the behavioral part of the study and supported me with the fMRI analysis, and also to Peter and Anke Gasser, Juraj and Sonja Stick, as well as Karim Tisira and Theo Huber for medical support during the retreat. And we also want to thank our collaborators and especially also our sponsors that supported this study. And again, if you're interested to get updates on the documentary or become involved, please feel free to get in touch with Miloš Savić. Thank you very much for your attention.
Are there any questions?
I got here a little late, so I don't know if did the meditators involved have different styles? I know you talked about focus, attention, and open
monitoring.
Monitoring. Were those the only two styles that were used? Did they come in with their own style, whether it be some type of yogic or qigong? And how did that change the effects, if at all?
So the whole retreat was held in a Zen tradition, like a Zen meditation tradition. So that's why we recruited preferentially people with a background in Zen meditation or Vipassana meditation, which is closely related. During the retreat, they were just instructed to observe silence, so not engage in any special type of focused attention or open monitoring practice. But usually focused attention practice on the breath is the core practice in Zen. And during the fMRI scans that I showed, they were specifically instructed to focus on the breath or to open their awareness. So in the fMRI study, we have kind of more specific instructions. But as you can see, we have quite homogeneous effects. So the fact that people engaged in a 5-day retreat had both impacts on open awareness and on focused attention practice.
We just have time for one more.
Thanks. Thanks, Milan. One of your findings was around increased depth of meditation. I was just wondering, is that self-rated? How is it measured? And were people having bigger depth of meditation in open awareness or focused meditation?
Thank you. We used the self-reported meditation depth questionnaire that participants filled in at every evening after every day of meditation during the retreat. So that's how we could measure the progression of the meditation depth during the retreat. I didn't show the data of the self-reported meditation depth in the scanner. So that was actually the same scale, but the data that you saw were the meditation depth over the retreat. Yeah.
Thank you so much. Thank you so much.